Welcome to today's Explainer. We're going to dive into a super common, yet, rarely discussed male physiological process. We're unpacking the truly fascinating biology that's working completely behind the scenes.
It's a question countless guys have asked themselves, right? But nobody really talks about it openly. It usually comes with a little embarrassment or maybe some confusion. But today, we're stripping away all that awkwardness. We're going to look closely at this daily occurrence and reveal what it actually tells us about a man's overall health and, specifically, his vascular system.
To do that, we'll map things out by looking at the morning erection myth, the biology behind it, what happens during sleep, built-in tissue maintenance, how it acts as a barometer for your health, and finally, protecting your long-term health.
All right, let's jump straight into Section 1, the morning erection myth.
So a lot of people just assume these morning wake-up calls are driven by erotic dreams or conscious arousal. But the reality? Well, scientific studies actually prove these events have very little to do with sexual thoughts. In fact, they often happen without any dream recall whatsoever. Instead, what we're looking at is a completely natural, automatic biological function, one that basically reflects the overall operational status of your body.
Which brings us to Section 2, the biology behind it.
So if it's not a dream, what's actually causing this? To really understand it, we need to trace the physical journey of how an erection forms. And it doesn't start down there like you might think. It actually begins far away, right up in the brain. Basically, the brain sends these electrical signals down the spinal cord. Those signals hit the pelvic nerves, which then release some vital chemicals, the big one being nitric oxide. Now this nitric oxide causes the smooth muscles inside to relax, which allows the blood vessels to widen dramatically. Finally, a huge rush of blood fills two sponge-like structures called the corpora cavernosa. They expand, compress the draining veins, and boom, the blood is trapped. It's like a highly coordinated hydraulic system. This step-by-step process requires a perfectly timed, incredibly delicate balance between your nervous system, your blood vessels, hormones, and healthy tissue. If even one of these steps gets disrupted, the whole process fails.
Moving on to Section 3, what happens during sleep.
Now that we know the mechanics, let's look at how this delicate balance operates entirely on autopilot while you're completely unconscious. The official medical term for this is nocturnal penile tumescence, or NPT. See, sleep isn't just one big continuous block. Your brain cycles through different stages, including REM, or rapid eye movement sleep, every 90 to 120 minutes. And during REM sleep, your parasympathetic nervous system, which is basically your body's rest and digest mode, kicks into high gear. This creates the absolute perfect internal environment to naturally trigger erections without needing any conscious sexual stimulation at all.
And because of these natural sleep cycles, the average healthy adult male actually experiences 3 to 5 of these physiological events every single night. Let that sink in. And again, this happens totally regardless of what they happen to be dreaming about.
Even crazier, each one of these 3 to 5 events can last anywhere from 20 to 40 minutes, and sometimes even longer. So the really crucial takeaway here is that what we commonly call a morning erection isn't actually a morning phenomenon at all. It's literally just the final nocturnal erection of the night that happens to overlap with you waking up from your very last REM cycle.
Let's look at Section 4, built-in tissue maintenance. Which brings us to a pretty fascinating question. Why on earth does the human body automatically trigger this complex process multiple times a night? Well, scientists are still putting the whole puzzle together, but the leading theory is that it acts as a built-in natural maintenance program. Think about it. Just like your skeletal muscles need regular movement to stay healthy, penile tissue requires periodic flushes of oxygen-rich blood. By triggering this during sleep, your body's delivering massive amounts of oxygen to those tissues. This actively helps maintain tissue elasticity and preserves smooth muscle function. It's basically your body running routine, automated maintenance in the background to protect your long-term erectile health.
And this automated maintenance is heavily supported by your daily hormonal cycles. Testosterone levels naturally peak in the early morning hours and then gradually taper off as the day goes on. So this morning hormonal surge acts as a strong supporting pillar, creating optimal conditions for that final nocturnal erection we just talked about. But remember, testosterone is really just one piece of a much larger puzzle here.
This brings us to Section 5, a barometer for your health.
Because this whole process requires multiple bodily systems to fire perfectly in sync, doctors actually use it as a fantastic diagnostic indicator. Let's imagine two different guys who both complain to their doctor about erectile dysfunction during intimate moments. If the first man reports that he still regularly wakes up with morning erections, well, that tells the doctor his physical hardware, the blood flow, the nerves, is likely functioning perfectly fine. The issue during sex is probably psychological, maybe stress or performance anxiety. But if the second man reports that his morning erections have completely vanished for months, that is a massive red flag. It points directly away from psychology and straight toward a potential underlying physical or vascular issue that needs investigating right away.
When those automatic nighttime processes just stop, it can actually signal several pretty serious medical conditions. You see, the arteries supplying the pelvis are way smaller than the coronary arteries supplying your heart. So if plaque or vascular disease starts to restrict blood flow in the body, it almost always shows up in these smaller arteries first. Meaning, reduced nocturnal erections can literally be one of the earliest warning signs of cardiovascular disease. The exact same goes for diabetes, where high blood sugar can damage those delicate nerves and vessels. It can even point to severe sleep disorders like untreated obstructive sleep apnea, which fragments your sleep and completely wrecks those REM cycles we mentioned, or even underlying neurological disorders.
And finally, Section 6, protecting your long-term health.
Recognizing these signals is absolutely crucial. Now, before anyone hits the panic button if they miss a day, you should know it's perfectly normal for these to occasionally vanish due to temporary disruptors. If you had a terrible night of sleep, maybe drank a bit too much alcohol, are dealing with high stress, or you're just fighting off a cold, your nocturnal erections are going to take a temporary pause. That is totally normal. Plus, their frequency and rigidity do naturally decrease as guys get older. However, it's the long-term factors, like chronic smoking, which just destroys nitric oxide production, or obesity, which tanks testosterone, that can permanently damage this incredibly delicate system.
If you do notice they persistently disappear over weeks or months, getting a medical evaluation is definitely a wise move. But here is the really encouraging news. The exact same habits that protect your heart protect this system too. Adopting habits like regular aerobic exercise to keep your arteries clear, getting adequate, high-quality sleep to protect your REM cycles, managing your stress to keep that cortisol low, and eating a balanced diet, all of this will profoundly support both your vascular and erectile health. Ultimately, this whole phenomenon really shouldn't be a source of awkwardness. It's actually one of the body's quiet, brilliant reminders that your organ systems are working together exactly as nature intended in the dark. It's a fascinating reflection of normal human biology that acts as a vital health dashboard for guys. So the next time you wake up, instead of just ignoring it, ask yourself, is your body's internal early warning system telling you that your cardiovascular engine is running flawlessly, or is it quietly suggesting that it might be time for a tune-up?